Today we are going to do a wet to dry wound dressing for our patient. We have checked the patient's records and the doctor has ordered a changing to be done every 8 hours. I have ensured that the patient has no latex allergy, no microbial agent allergy, and no tape allergy. It is now time to change the patient's dressings and I will be demonstrating how to do so. I'm now going to wash my hands and gather the supplies before entering my patient's room. Good morning, Miss Joanna. How are you this morning? I'm your nurse, Samara Martin. Can you tell me your date of birth? Okay. Can you tell me your name? I had given you some pain medicine earlier for this procedure. You said it was a 6 out of 10. What is it now? On a scale of 1 to 10, 10 being the worst. 2, all right. I'm going to be doing a wet to dry wound dressing today on your right leg. We're going to do this every 8 hours so you will not acquire an infection, and this will promote healing for your wound. I am going to close the curtain for your privacy. And I'm going to pull back your blanket to only expose your wound. I'm going to place a sheet under you so we don't soil your linens. Alright, I'm going to apply clean gloves. I will start by taking your old wound dressing off. I'm going to pull the tape towards the wound to remove the bandage. We're going to add some sterile water to help the bandage come loose. And now we will dispose of the bandage and gauze into a red trash bag. I am now going to wash my hands and put on new gloves. We are now going to get some sterile water and irrigate the wound. We're going to use this basin to catch the sterile water from draining off the wound. We ensure that we do not let this touch the patient's inside of the wound. We just get close enough just to clean the wound. We are now going to get some new gauze and dab the wound dry very gently. Then I'm going to wash my hands and change gloves again. Now we're going to get the tape ready for our new bandage. I'm going to get some cleaning agents. This is a microbial agent. I'm going to clean the outside skin around the wound. Be sure not to get this inside the wound, just the outside. We're going to let that dry. While we're letting it dry, we just got done letting it dry, and now we are going to measure the wound. We are going to measure the length, width, and depth of the wound. We will document this later. I've used sterilized water, and we are going to wet the new gauze and fluff the gauze. We're going to place the gauze into the wound. I'm going to place an ABD pad over the gauze, and then I'm going to apply tape. I will now initial and sign and date the wound dressing for a timestamp. We will place all the trash into the bag and wash your hands. I'm going to cover the patient back up and ensure the patient is comfortable. I'll put the patient's belongings near her for her to reach. I will ensure the side rails are up and that the bed is at the lowest position. And now I'm going to go document my procedure. Thank you.